Now, people with diabetes have a lifeline during this pandemic and can fight off coronavirus if their diabetes is well controlled and they manage their blood sugar levels. This is according to the Diabetes Management Resource Center, DMRC. The center is also calling on the government through the Ministry of Health to help inspire confidence among the diabetic community by addressing misinformation on the link between diabetes and COVID-19. The sentiments come after Health Chief Administrative Secretary Dr. Rashid Aman on Saturday urged those with diabetes to avoid unnecessary movement since they are twice as likely to require intensive care if they contract COVID-19. Here is Alice Diana with that story.
Kenya has a total of 552,400 adult patients who have diabetes, 2.2% prevalence from an adult population of over 25 million. Diabetes Management Resource Center DMRC founder Duncan Motanya has expressed concerns as diabetic patients continue to live in a lot of fear due to rising reports linking their conditions with the severity of coronavirus infection. The country's health ministry on Saturday termed diabetes, obesity and hypertension as risk factors for COVID-19. Health CAS Dr. Rashid Aman said that 16% of critically ill COVID-19 patients had diabetes, while diabetes and hypertension combined accounted for 47% of those who have died from pre-existing conditions.
Diabetic complications such as diabetic kidney disease and ischemic heart disease may complicate the situation for people with diabetes, making them frailer and further increasing the severity of COVID-19 disease and the need for care such as acute dialysis.
According to DMRC, high blood sugar levels and a persistent state of inflammation are the main factors that make it difficult for people with diabetes to recover from COVID-19 and other illnesses. DMRC founder Duncan Motanya adds that this happens with every other chronic diseases, not just diabetes mellitus. He was speaking during the donation of 400,000 shillings to go towards purchase of drugs for persons living with diabetes.
We felt that we should step up and support where we can. So our small donation to DMRC, we hope, should be able to assist them to purchase drugs and maybe any other essential medication that they may need.
Diabetics have been urged to ensure that their bodies are very well prepared to fight this nuisance by observing high levels of personal hygiene, avoiding crowded places, having their blood sugar well controlled, and general health taken maximum care of. The center is also calling on well-wishers and the private sector to help those who are diabetic and are unable to purchase medicine during this time of the pandemic.
There are people who are needy in terms of who do a lot with the health that can come out of the initiatives like maybe donations from the public or the private sector to be able to help them purchase maybe the medicine they want or any other essential equipment they might need to manage their conditions.
DMRC is leveraging on virtual health experts to guide patients on best ways to manage or prevent other nutrition-related chronic diseases like obesity and cardiovascular diseases. Reporting for Hope TV News Watch, I'm Alice Diana.